Hello everyone, happy morning, a very good morning. I hope and I believe all of you are doing well. A quick note whether I'm audible and visible, everyone. Yes, okay. So I was just waiting for your comments there, and I hope everybody can hear me and see me, right? So, yes, thank you so much. There is one Makhi also has come to join the live class, and it's going to irritate me. Okay. So, I hope all of you have taken a good rest yesterday, guys, and I believe that you would be appearing for the NEET PG exam as well. Right, not because you will not get good results, but you should always do that because even when I entered my residency, I took up MD Radiology in Mumbai, but still after that, I did appear for AIIMS exam as well. Right, though I did not want to take an admission there, but I was like, let me just try giving an exam and see where I stand. So experience के लिए सिर्फ so that you have your first hand experience, how's INICET, how's NEET PG, your first hand experience, you should definitely be giving all the exams. Okay. Yes. So the exam, I would honestly tell you that if you do not do good in this INICET exam, please do not feel sad, because the paper, like now when I've done all the 200 questions authentic recall, I realized that so many questions, the answers they were not logical. They were not clinical based, right? There's no concept there. Male is affected more, female is affected more, right? So many questions on that. Why should that be tested in the PG entrance exam, right? It should be more a test of the clinical based knowledge that should be tested. So personally, this is my personal opinion, that the INICET exam was not something which tested the real knowledge of the medical students. And second, I believe that NEET PG paper is much better than the INICET paper. The questions are very discrete questions. No such nonsensical options like male affected or female affected more. So it's absolutely fine, guys. If you're targeting NEET PG and you have not done well in INICET, it's absolutely fine. If you have not done good in INICET, does not mean that you will not do good in the NEET PG. Okay, the NEET PG paper is going to be definitely different, and I believe better than the INICET paper, right? Just to put that multiple options correct wale options, or just to find out the false statement out of the 4 options, you give any irrelevant options, that does not make any sense, right? Like the question on myelodysplastic syndrome, the question on febrile seizure. We will discuss all of that with all the options. Yeah, it was more of very fact based, and even in fact it was not like the facts of the anatomy, physiology of course was there, but like I said, epidemiology, I mean, that's something that should not be tested, right? So let's start with the discussion, guys. I have shared the PDF of the 200 questions, rather I got 201 questions. Either there is numbering problem or there is some question which I have written repeat, right? So we'll probably with the discussion we'll get to know that ki kya repeat hua tha. Okay, so and this is about, since the exam has got over, now I'm getting all the messages, ma'am, please the schedule for the upcoming NEET PG. So I will give that to you tomorrow. So tomorrow I will be giving you the entire schedule of how you should be planning your revision for the upcoming 1 month, how you should make the best of the last 1 month that you have for the NEET PG, and how I would be helping you in making your dream come true, and how we are going to crack it together. So no matter whatever stage of preparation you are in, do not worry, we are going to do this together. And Rather than 24th May, we might start it earlier as well on 22nd or 23rd itself. So I'll give you the entire update tomorrow. So just wait for that and make sure you are subscribed to this channel and with the bell icon on so that you do not miss on that session where we discuss the plan for the upcoming 1 month. Right, and I hope all of you are ready to attend the Pan India live online sure shot that we are going to have in-app live classes, right, 2 hours daily without affecting your primary revision timetable. So I'll give you the entire day plan out as well, okay, how you should incorporate the sure shot into your current revision plan, whether you have done it before or you have not done it before. If you have not done it before, you definitely have to do it, guys. Trust me. I myself realized that mnemonics are such a time saver in the exam. They come to your brain such reflexly and they save you a lot of time. Right, and they help you save that time for the questions which are more tricky, more lengthy questions. So provided you have the mnemonics in place, you know, they give you a lot of time for the rest of the questions. Okay. Yeah, so let's start discussing this one. App link, Dr. Kanya, you can just search for Synapse app by Dr. Nikita, Synapse by Dr. Nikita. This is the logo here, both in Android and iOS, you will get that. Okay, and there is the book also available, guys. So please make sure if you are attending the sure shot classes, you have the book also, so that as we are discussing, you make the notes, like I make the notes during the live class, you will make the notes with me and you are done and dusted with that. So I'll give you the entire plan tomorrow, just that make sure you are registered for the same. Yes, Shivam, that's what we'll be doing. So let's start discussing the questions here, and guys, please let me know. You know, wherever you feel that this should be the answer, that should be the answer, please let me know your opinions as well. Okay, right. So the first one here, there was this image which showed you the pharyngeal muscles, the superior constrictor, the middle constrictor muscle, and the question was what structures passes in between the two. Right, many questions actually could be solved with the cheat codes, the MCQ solving skills. So you were given the image which showed the two muscles. Now use the logic that if it is attached to thyroid cartilage, cricoid cartilage, then it is the inferior constrictor, like you see here. So thyroid cricoid wala, the thyropharyngeus, cricopharyngeus is what is inferior constrictor. The muscle which was given were these two muscles, and this is where it was asked what structures pass through it. So it is the glossopharyngeal nerve and the stylopharyngeus muscle. Okay, the glossopharyngeal nerve and the stylopharyngeus muscle is what passes. I hope you remember from our pharyngeal arch videos as well. Stylopharyngeus P ka ulta is 9. Remember, that's the muscle of the third arch supplied by the 9th nerve. The pharyngeal muscle supplied by the 9th, P ka ulta is 9. So the answer here is going to be 9th nerve, stylopharyngeus. Next question on neuroanatomy was the structure not related to the floor of the inferior horn of the lateral ventricle. Okay, and so remember the answer there is the tail of the caudate. Okay, the answer there is tail of the caudate. The other three options were fimbria, collateral eminence and hippocampus. These are related to the floor of the inferior horn of the lateral ventricle, but the caudate tail is not related. Okay, caudate tail is superior medial. It is not on the floor. Okay, so the answer for that is going to be caudate tail. Next, there was this one image where you were given in the question 2 images, and they told you that somewhere the arrow marked here, the image was a bit different, but it was a similar image. So this connects to what part? So again, you know, use the cheat codes, logically thinking. This is something I see is cerebellum, and they are giving me some image of the midbrain and ajubaju structures. So that should ring a bell that probably they are marking towards the dentate nucleus, and you know that the dentate rubrothalamic tract. Right, the dentato-rubrothalamic tract. Rubro means the red nucleus. So it is related, it goes to the red nucleus of the midbrain, right? So this is what should have been your answer, the 4 options labeled in this image. The one arrow which was pointing in the midbrain, that is the red nucleus. Okay, that is the red nucleus. Is this clear with everyone? Yes? So remember, that was the answer, that was dentate and rubro. Next one, image, can someone help me with that image of the heart ka jo image aaya tha? The cadaveric image of the heart, and they asked you the artery supply. Anybody has any inputs on that? Yes. Yes, Dr. Apoptosis, absolutely. I hope you are using the MedSynapse app to help you in that. The number of corrects required for the top 1000 ranks or 100 rank or 200 rank. So I believe that this paper will have maybe a higher cutoff as well. So remember 140 to 150 correct is what should give you the top ranks. Yes, Midun, that's why this is authentic recall. All right. So something that I could see that was there was this interventricular septum. Uske upar ka area was marked. So was it the membranous part of the interventricular septum or what area they were trying to point out? I really don't know about that. So I think it was interventricular septum is what I thought, and the answer should be then the anterior interventricular artery. Okay. So I'm putting a star mark wherever there's some query, right? Not very sure about that. So remember, anterior interventricular artery probably should be the answer there. Next one, what is your take on the abdomen level? What is your take on the abdomen level? The image which was given, the cross-section image which showed the liver, the aorta, IVC was seen, and the stomach also was seen, with spleen also was seen. What was that? Yes. Anterior interventricular was there. Okay, it was there in the option, definitely. Yes, yes, Ron, you can do that. So T10, T11, T12, those were the options there. So definitely what I can tell you is the answer was not T12, because if you see the T12 level, the cross section at T12, the kidney should be present at the T12 level, which was not there. So this was at a higher level, right? So most probably the answer will go to T10. Okay, it was T10 level is what I believe. It was the abdomen, the upper abdomen. Kidney was not seen. T10 is what should be the answer there. Next one, ischial spine level. Ischial spine, what does the ischial spine correspond to? Yes. Is it S3, S5? Are you guys pretty sure about that? The ischial spine? Yes. Kidney nahi dikh raha tha na, Swamita. Kidney was not seen. So surprisingly, the answer here, remember, this has to come is the tip of the coccyx. So read about giving the block at the ischial spine, jo pudendal nerve ka karta hai, and there you will read that I have dived into the theory part of it, and that is why it took one day for me to research into the answers of all the questions. And so this was ischial spine is coccyx. Okay, the tip of the coccyx. Okay, next one, the image of the lung hilum, and it marked anteriorly the nerve. We have discussed in the binge revision, remember, phrenic nerve, phrenic FR is in the front. The nerve related anteriorly to the hilum is the phrenic is in the front, vagus is behind. So that was the phrenic nerve. So it was nothing to do with the sympathetic wala. So phrenic nerve ka root value hota hai C3, C4, C5. So that will be the C4 made where it should have one of the root. Okay, that should be the one of the root. Okay. Next one that you have here is vertebra does not form which joint? ठीक है, ये वाला भी मैं यहाँ star mark कर रही हूँ. So many queries here. We'll dive into it more and see exactly what was the answer. ठीक है. Next one, vertebra does not form which joint? Vertebra does not form syndesmosis. Okay, it does not form syndesmosis. Again, you could use the trick here. Syndesmosis, you know, is a fibrous joint, right? That is the fibrous joint. So you do not see, you do see the symphysis, the intervertebral wala is the symphysis. You do have the plain joint with the rib is what it forms. Remember, it does not form the syndesmosis. Osteoporotic fracture, You know that when there is osteoporosis, the vertebral fracture, the collapse of the vertebral fracture is very common. So the soft bone vertebra, the weight bearing bone vertebra is affected. Remember, vertebral fracture. Okay, vertebra. Next one, cardiac ventricular myocyte. Question from the physiology. What do you not see? Of course. See, these are, I'll give you the tricks on how you could guess the answer even when you do not know. Somebody who has given the INICET exam without reading anything, how you can logically think the answer. So, a cardiac muscle cannot go into a tetanus, right? It will be into a persistent contracted state, which we do not want. Heart cannot go into tetanus. So, remember, there will be no tetanus. If you remember the action potential of the cardiac ventricular muscle, it is more broad, right? So that means the refractory period is longer. There is a length tension relationship. The Starling's law comes into play, and you have the other was length tension relationship, increased refractory period, all or none phenomenon. Okay. So remember, the answer will be no tetanus. There will be no tetanus there. The increased refractory period will not allow the tetanus to set in. Next one, short ka question, right? Favorite, which we have learned with the incoming road and the outgoing road, and this is the bypass, the GFR. So those who know it, you would understand what I'm talking about. So GFR, the glomerular filtration rate decreases by increasing the Bowman's hydrostatic pressure. We have discussed this, the Starling forces for the GFR. The glomerulus hydrostatic pressure is the positive force. The Bowman's hydrostatic pressure is the negative force. So that is going to be the answer there. Okay, that's going to be the answer there. Next one, erythropoietin, right? Erythropoietin comes from which organs? Multiple options there: kidney, liver, lung, spleen. The answer there is going to be kidney. Okay, the answer there is going to be kidney. Then there was this clinical history of a patient of Cushing's, bruisability, obesity. What is it due to? Hypercortisolemia. Okay, that is because of hypercortisolemia. Okay, clear with everyone? Everywhere with this action potential, that's all or none, right? Action potential is all or none. Next one, most potent form of estrogen. Again, the cheat code that you could use here is, if you know the mnemonic estrone, estradiol, estriol, estrone is 1. That is seen when the female is a single female, right? A widow, a single female, postmenopausal female, estrone. Okay? Estradiol, diol, di, the reproductive phase, that's the most potent phase. So, most potent is the reproductive phase. So, the answer there is going to be estradiol. This is how I always tell you that, how do you logically guess the answer? Someone who gets great scores is not because they know the answers definitely, but they integrate and logically think and try to rule out the options. Okay? Right? Next one, growth hormone somatostatin. This image based question was there, right? The one which is inhibiting, this was somatostatin, this was GHRH, and this was growth hormone. So the one which had the option with somatostatin wala, right? The A is somatostatin, B is the GHRH, and C is the growth hormone. Okay? Next one, the image of the adrenal cortex and the medulla. You could easily rule out the options by the adrenal medulla secretes the epinephrine, and you know the top 3 layers GFR. Sabse upar aata hai salt, then it is sugar, that is mineralocorticoid, glucocorticoid. So from top to bottom it was ABCD which was labeled. So aldosterone, then cortisol, and those androgens, and then the epinephrine from the medulla. Okay, epinephrine from the medulla. Next one, lactic acidosis will be seen in what deficiency? Congenital deficiency of pyruvate dehydrogenase. Pyruvate dehydrogenase will have lactic acidosis. Again, something we have discussed in short. Hypercholesterolemia, 2 questions related to cholesterol. Hypercholesterolemia is LDL receptor, right? ApoB100 LDL receptor, again something we have discussed in short. We have also discussed PCSK9 inhibitor drug, evolocumab, alirocumab. So PCSK9 is evolocumab. Next was match the column question on glycogen storage disorders, which was very easy one. McArdle's exercise intolerance, Corey's accumulation of branched glycogen, Van Gerke's lactic acidosis wala jo tha, and Pompey's lysosomal accumulation. Pompey's is the only glycogen storage disorder which is also a lysosomal storage disorder. acid maltase alpha glucosidase is the enzyme deficient, right? So that was glycogen storage disorders. Hypogonadism or delayed sexual maturity, right? This is what was given. Hypogonadism, delayed sexual maturity will be seen in deficiency of zinc. Okay, that is seen in deficiency of zinc. Next one, it was multiple option correct, so you'll go with kidney plus liver here. Okay, kidney plus liver. Happy? Question on folate deficiency, which is a bit of a controversial questions. Many questions in INICET unfortunately are controversial questions. You are easily able to rule out the two options, but even when we are diving into the looking at the answers, there are two options where there is a controversy. So tell me that folate deficiency may, what do you think was the answer? The options was increased homocysteine, normal methyl malonic acid, correct the B12 deficiency first. Increased deficiency is seen in children with hemolytic anemia, and it decreases the neural tube defects once you started when the pregnancy is detected. What do you think will be the answer to this one? Right. So now I have searched into it. Definitely these two are not the answer. We have ruled out two options, like I said, were easily ruled out. This is a true statement. If you just Google it out and try to see that folate deficiency in children with hemolytic anemia, this is a known thing. Okay, this is a known thing. So remember, folate deficiency in children with hemolytic anemia is seen. Starting pregnancy detection, actually probably this was the answer here. They were trying to test your knowledge on this should be started before the conception, right? Pre-conception start karna chahiye. Folic acid ideally 1 month prior to conception. So this seems the correct answer according to me. Folate deficiency in children with hemolytic anemia is a known thing. Okay, that's a known thing. Okay, so this looks to be incorrect. The question was not saying that folic acid deficiency causes hemolytic anemia. We know that vitamin E deficiency causes hemolytic anemia, or excess of vitamin K causes hemolytic anemia. The question was deficiency is seen in children with hemolytic anemia, and that's a correct statement. Okay, that is the correct statement. So yeah, this is false. NTD should be ideally started before the pregnancy is there, right? So even before the female is planning to conceive, like 1 month before that, it should be started. False statement ye hoga according to me, incorrect ye hai. Next one, can you help me recall the options of G6PD deficiency? One was reduced production of NADPH. One was males and females are affected. It was not males and females are equally affected, was not there. It was just given that males and females are affected. Then it was oxidative stress, and then it was hemolysis. मैंने लिखे हैं चारों options already. Okay. So remember that this one here, the best answer that you have to go with is males and females affected, even though it did not mention equally affected, right? X-linked, we know that this is X-linked recessive, so males are affected more, but out of like the females can also be affected if they have a homozygous mutation or one X is silent, but depending on the options, the best answer to go with is males and females are affected. Okay, males and females are affected. It was not equally given in the question, I'm pretty sure about that. It was just given males and females are affected. Next question, Hodgkin's lymphoma. Waldeus is the most common site. This is the false statement. Waldeus is the most common in the non-Hodgkin's lymphoma, not the Hodgkin's lymphoma, right? Because Hodgkin's, aapko pata hai ki you have the lymph nodes, right? The lymph nodes per se are involved in Hodgkin's, not the Waldeus. Next one, Reed-Sternberg cell is B cell origin. Nodular sclerosis, most common in mediastinum, correct. PAX5 positive, CD15 positive, that was correct. So Waldeus is incorrect. Another question which I told you was there is an error in the match the column, the lymphoma wale options, malt lymphoma, H. pylori, skin wala Borrelia diya tha, right? Then you had Campylobacter jejuni. There in match the column, it was 1, 2, 2, 4. Right, so there was a typing error there, and that could have led to error in some of you marking the options if you were not cautious of that, right? So that was the answer. We all know that in match the following questions, guys, try to first see what do you know out of the 4, and based on that try to rule off the options. That is the trick there. So H. pylori, all of us know that gastric, the malt lymphoma is what it is associated with. So based on that you choose the answer, malt lymphoma, H. pylori, Campylobacter jejuni, alpha heavy chain disease wala tha, Borrelia skin wala tha, right? That was the answer there. Okay, that was the answer there. Okay. Next one. Parvovirus, which of the following is not true about parvovirus? INICET always tends to ask question on parvovirus, right? So according to me, the answer will be fever with petechial rash. It does not cause per se, it is not the petechial rash, it is the maculopapular rash. Okay, that is maculopapular rash. So remember, it is fever with petechial rash. एक से टाकी वाला था, correct. Next one, HSV2 wala question, genital ulcer in the mother and now the child has some meningitis, encephalopathy, encephalitis wale features, or abdomen pe bhi vesicles the encephalitis tha. The answer for that will be HSV2. Normally herpes encephalitis per se is HSV1, but when they are telling you that genital mother se transmit hua hai, then it is HSV2. Okay, then it is HSV2. ठीक है. The match the column for virus, single stranded RNA, double stranded RNA. We have discussed the mnemonic for that. Parvo, remember parvo single stranded DNA है, parvo DNA है, parvo single stranded DNA, parvo single stranded है. Rota भी हमने discuss किया था, binge revision recently we had taken. It is a double stranded RNA, right? Rota is a double stranded RNA. Pox वाला था या papilloma वाला था, it is a double stranded DNA virus, and COVID is a single stranded RNA virus, right? The SARS-CoV-2, COVID is a single stranded RNA. So the trick here was to know the exception parvo single stranded DNA and rota double stranded RNA. Again the confusing question, the controversial question is there, right? Genital ulcer, वहाँ पे vesicles mention था Dr. Sneha mother में. Dengue में remember day 5 was given, day 3 रहता तो it would have been very easy, NS1 the straightforward answer, but here now they gave you that it is day 5. So again the confusion here whether it is NS1 or it is IgM ELISA. I would, my personal opinion would be NS1 would be a better answer. Okay, NS1 would be a better answer here. ठीक है? Yes, great Amit. Next one, parthenogenesis. The good thing was they gave you the definition of parthenogenesis and that made the question comparatively easier, right? Logically thinking आप इसका answer mark कर सकते थे. So remember parthenogenesis is strongyloids, right? A single adult parasite leading to the larva. How you could have answered this question is, out of all the options that were given, the only egg which shows the larva is the rhabditiform larva जो हम बोलते हैं, it is seen in strongyloids. So that means when it is coming from the human intestine itself, the larva is already there, the the fertilization is already done. So remember it is strongyloids. Okay, it is strongyloids. So I'm putting this as controversial question guys. ठीक है, मैंने पहले ही बोला कि ये controversial है डेंगू वाला. Next one, malaria species के लिए कौन सा best है? Thick smear, thin smear with Gimsa, thin smear with acridin orange, or the quantitative Buffy coat? The best answer there would be thin smear with the Gimsa stain. Okay, thin with the Gimsa. Thick helps you just identify whether there is parasite or no parasite. Thin helps you to see the species. So it is thin Gimsa. Okay, thin Gimsa. Next one, plasma. Another question on malaria. Plasmodium falciparum का schizont, late trophozoite नहीं दिखता है in the blood. Why? Because this was assertion reason type of question. So the assertion was correct. The reason was also correct because it gets attached to the capillary, the venules, and it does not come in the blood, the peripheral blood per se. So remember the assertion reason. This was true. This was true. The assertion was true, and the reason was also true. ठीक है? Question on rotavirus vaccine. What did you mark the answer as, guys? इसमें क्या आंसर मार्क किया आपने rotavirus vaccine वाले में? Which is incorrect about rotavirus vaccine. Yes, cytoadherence was mentioned. Kushal and everybody here, I've already shared the PDF of these 200 questions on my Telegram channel. So if you want to mark the answers as we are discussing, you can do that. Okay, you can do that. विथ आंसर वाली भी बात जो भी मैं डिस्कस कर रही हूँ, अगेन आई शेयर दिस पीडीएफ ऑन द टेलीग्राम चैनल. फर्स्ट वाला मार्क किया. हाँ, is rotavirus a subunit vaccine, guys? All the vaccines that you actually read in a killed vaccine or a live vaccine, that means it's an entire organism there. It is not just a subunit of that which is there, it's the entire organism which is there. Yes, so the incorrect answer here will be subunit vaccine. It is not a subunit vaccine. Monovalent, pentavalent is available. We do give it orally. It leads to the side effect interception and it cannot be started after 6 months. The first dose that is recommended is 6 months. जो final dose है वो 8 months के beyond नहीं देना चाहिए. The final dose, first dose, this is a comparatively correct option here. Definitely it is not a subunit. Final dose आप 8 months तक दे सकते हो. The first dose is somewhere mentioned 14 weeks से start करना चाहिए the first dose. Okay, clear with everyone? Now, so remember it is the false is it's not a subunit. It's a live vaccine, so it's a complete virus. It's not a subunit vaccine. Next question on isospora. Remember the CC. सर्कल वाले कौन से होते हैं? सीसी, क्रिप्टोस्पोरिडियम, साइक्लोस्पोरा, सीसी are circle. Isospora, when you write I, remember it becomes an oval. So the key word here was oval, just that instead of isospora, they gave you cytoisospora. That's the same thing. Okay, that's the same thing. ठीक है? प्राइमरी के लिए पूछा था, ठीक है? प्राइमरी, remember that's the correct answer. सबयूनिट वैक्सीन नहीं है. Next of Cryptococcus. Cryptococcus, which of the following is true? Humans are not the only reservoirs. You know that pigeon dropping से होता है. CD4 less than 900. नहीं, 900 is a very good count. It's an opportunistic infection less than 100. Yeast with pseudohyphae are not seen. Pseudohyphae are seen in Candida. So lungs is the most common site. Now again, this is, I don't know why did they give this. The most common is lungs, the route through which it enters. But then the most common manifestation that we have here is meningitis. But out of the 4 options, the best option that fits here is lungs is the most common. Okay, lungs is the most common. Next one, assertion reasoning of diphtheria. Diphtheria does cause myocarditis, but not because of bacteremia. It is toxin. Remember our mnemonic diphtheria, di and tho. They act via EF2. Di is tho. Diphtheria acts via inhibiting EF2, the toxin. Okay, it is toxin, not the bacteremia. Next question, orbicularis oculi paresis was given, plus at the same time cornea insensitive was given. So this is the 7th nerve palsy but plus the 5th nerve palsy. Both the palsies are there. What do you think will be the answer there? What do you think would be the answer there? Explanation is not correct. Correct. Assertion is true, but the reason is not true. I mean, reason is false. उतना easy नहीं था. Actually, that's why I said that it was a seemingly easy paper, but नहीं था easy. बहुत tricky था. Right, correct. It is leprosy. Remember, insensitive भी साथ में दिया था. Had it been just the facial palsy, we could have thought of Lyme's disease. But here it was both the 7th nerve and the 5th nerve. So remember, that's why the better answer here, we will go for leprosy. Okay, we will go for leprosy. Coming to the next one, GERD, the extra esophageal manifestations. Again, this is a question which had an error where 2 options were same. 1 and 4 are correct, 1 and 4 are correct. But actually all were correct for GERD. It does cause laryngitis. It is associated with asthma also, pulmonary fibrosis also, and excess phlegma production as well. Okay, so the answer was all. Okay, the answer was all. Right? Achalasia, this was the barium swallow image. Identify what is it? It is achalasia, easy image. Crohn's versus ulcerative colitis. 2 options you easily ruled out. The confusing option here, daily hematochezia and increased cancer risk. Remember, increased cancer risk is present in both Ulcerative colitis is much more than Crohn's, but Crohn's also has 1 to 3% increased chances of the colon cancer. The better answer here will be daily hematochezia. Okay, that is more seen in ulcerative colitis, क्योंकि Crohn's आपका mouth to anus कहीं भी हो सकता है. I have checked this answer, guys, कि what all does it cause? All of this is the answer. Okay, all of this is the answer. Which is seen less, which is not seen. Okay, that was the option there. Coming to breast cancer, ER is a prognostic marker. Okay, ER-PR, you know that ER-PR positive, it's a good prognostic factor. So we read it in prognostic factor. Remember, ER is a prognostic factor. Next, there is a lot of confusion I'm seeing around happening, which is inflammatory breast cancer was a description, though there was that ulcerated mass, but there was this warmth and redness that was given. They were indirectly asking you the inflammatory breast cancer ka staging kya hota hai according to 8th edition of AJCC. The answer there will be stage 3B. Inflammatory breast cancer is stage T4D. So you don't have to go for T4B. It is T4D inflammatory and it is stage 3B. This is actually a previously asked question also. Inflammatory is stage 3B, but they asked you in a clinical format. So isme hoga stage 3B will be the answer. It is stage 3B, Sayantan. Okay. It cannot be M1 is incorrect. Inflammatory breast cancer can have, it is not that it cannot have metastasis, right? So it can be right, M1 भी हो सकता है अगर वहाँ पे हो. Thyroid surgery, next question was voice hoarseness post thyroid surgery. Is recurrent laryngeal nerve injured? So this could have been prevented by ligating the vessels, the superior pole ligation. Thyroid में अगर superior ligation करते हैं तो ELN injury होती है, नीचे करेंगे तो RLN होगी, right? The Beer's triangle has one of the boundaries as recurrent laryngeal nerve, so you should not operate in that area. So Beer's triangle was not the answer. It is superior pole ligation, superior pole. It was inflammatory breast cancer, right? It was inflammatory breast cancer. So the you give it stage T4D, not T4B. I agree the ulceration was given, right? But still, I will go for the redness and the warmth which was given. It is inflammatory breast cancer. Okay? Neonate with watering and photophobia, right? I hope these are the correct options. There was no option of ophthalmia neonatorum. Ophthalmia neonatorum nahi tha, congenital NLDO tha, right? So remember, it is congenital NLDO. Okay, congenital nasal lacrimal duct obstruction causes watering, but no photophobia. Okay, there will be no photophobia here. On the other hand, glaucoma was straightforward out. We know that it causes photophobia and watering, right? And entropy on congenital diastichiasis, basically it will, the eyelash going inside will cause the irritation and lead to photophobia and watering. So the answer here will be congenital NLDO. Next question in ophthalmology, right, the answer there is phacolytic glaucoma, where you had a 80-year-old patient who had cataract also, and what else did they give you? That the flare was also present, right? The flare was also present. Acute red painful eye was given. So remember, cataract, lens में से phacolysis, okay, the proteins coming out that leads to the flare, the increased pressure, phacolytic. Just that the mistake here was right and left was interchanged when they give you the pressures. Left में pressure उन्होंने ज़्यादा दे दिया था, जबकि symptoms were more on the right. That was just an error there. So it is phacolytic. Okay. Next one. भाई स्टेज 3 जो हम बोल रहे हैं ना प्रकाश, वी आर नॉट टॉकिंग अबाउट T1, T2, T3 और T4. We are talking about the combined stage, right? When you look at that TNM staging, they particularly asked you the AJCC 8th edition, which is the TNM staging. So the combined staging is stage 3B. We are not talking about T1, T2, T3. Next one, a person using thick glasses since childhood now has flashes present. Remember, I've told you in short also, the flashes आता है, floaters आता है, curtain drawing over the eye आता है. They are telling you something related to the retina and the vitreous. So that is retinal detachment. Remember, high myopia, when they are telling you using since childhood, high myopia is a risk factor for rheumatogenic. rhegmatogenous retinal detachment. So it is retinal detachment. Okay. Next one, what is anisometropia? Anisometropia is difference in refractive error. Okay, difference in the refractive error. Anisometropia. Chemical injury to the eye, one question was there. The answer there should be normal saline irrigation is what you should be doing, not the other option. The first thing to be done is washing. Washing with the irrigation or washing should be the first option here. Next one, the image based question, the pigmentation, bony spicules wala retinitis pigmentosa. You definitely know that night blindness is a late feature, is an incorrect statement. Night blindness is early. Cords and rods and cones are affected. A waves is affected early, diminished A wave, then B wave is also diminished, right? So remember the answer there is night blindness is a late feature. You see early night blindness. All of this also we have discussed in the short. Next, very logical question. Even if you don't know the answer, you have to logically guess here. A child with bilateral SNHL, what will you not do? Grommet insertion, adenoidectomy, myringotomy will not be done here because you do it for adenoids, you do it for ASOM, the serous otitis media, which causes conductive hearing loss. No way this is going to help in the SNHL. Using the hearing aids, cochlear implant, sitting in the first row in the class, that was the third option given, right? But logically thinking, remember, this is used for congenital, the conductive hearing loss, not for the SNHL. Okay. Next one, ASOM. What is false about ASOM? Common cold can cause it. It's bilateral, straightforward again. You know, this is the example of the exam where you know the answer, do not think about the rest of the options. Do not try to overthink and get confused. You know that AD curve, remember the mnemonic we have discussed, AD. D for discontinuity of the ossicles, which is seen in a patient of trauma, right? So, AD is seen in trauma. We have discussed that serous otitis media, which contains fluid, FLFL. Fluid wala causes flat curve. Okay, it causes a flat curve. So, which is called what curve? Flat is like a baseline, basal curve. So, that is type B. Okay, that is type B. So, this is going to be the answer there. Bell's palsy wala question tha and they gave you that radiologically kuch bhi abnormality nahi hai. There is no other clinical finding apart from the Bell's palsy, right? So, remember, whenever there is everything else is normal, it's just the Bell's palsy which has come in. Steroids are the most important treatment there. So, steroids was the option which had steroids was only one option. Along with this, acyclovir was given. So, the only option which had steroids was this option. So, we will go with steroids, acyclovir wala. Next one, can someone help me with this question guys? इसमें क्या options थे? Post parotid surgery, lower lip पे palsy हो रहा है, कौन सी nerve injured है? What was that? Steroids वाला एक ही option था तो हम उसमें जाएंगे, right? We had no other option there. Acyclovir, herpes is known to cause like involve the facial nerve, very common. Yes, so we did not have the option of marginal mandibular nerve here, right? The option of marginal mandibular nerve was not given here. क्या किसी ने चार options लिखे हैं? Mediscope, temporal, cervical, main trunk and the parotid duct. Parotid duct. So, what do you think will be the answer here guys? So, actual nerve which causes this lower lip palsy is the marginal mandibular nerve. The marginal mandibular nerve, but that was not given. So, what you will go with is the main trunk. When the main trunk goes, rest everything goes. So, you will go with the answer of the main trunk. Okay, this is what I believe. So, main trunk should have been the better answer. I hope they are not considering the cervical one. Okay. Next one, the histopath image of a granuloma cervical lymph node was given in the question with the image given. TB है कि sarcoid है कि कुछ और है. Cervical lymph node, remember, will go more in favor of TB as a clinical feature as well. Sarcoidosis more so causes hilar lymph node, not the cervical lymph node. So, TB would be a better answer here. Caseating था नहीं था? I actually don't know that. Diabetes mellitus drug which causes, which is known to cause unknown diarrhea. The answer here will be metformin. Okay, it will be metformin. Diabetic patient, hypertension भी है, ejection fraction 50% है. Which drug you will give here? SGLT2 inhibitor. We have discussed in short classes that the flozins, like dapagliflozin in heart failure, flozins have been shown to be effective, right, better in heart failure. ठीक है? So, but वेंकटेश और कुछ ऑप्शन वहां नहीं बैठ रहा था ना, तो उसमें ही जाएंगे. So, flozins will be the answer there. Flozins. Which diabetic drug causes increased UTI? Again, the answer is going to be the flozin option, which was there. Diabetes mellitus drugs, there were 3 to 4 questions there. I mean, that ruled pharmacology. Okay. Next one that we had. So that's what I'm saying. This also I will keep it. कहाँ गया हमारा TB और sarcoid वाला, so that you guys do not get confused. I'll put it as a controversy one because image exactly I don't remember the image. ठीक है, what was that? Next one, atrial fibrillation वाला दिया हुआ था. Atrial fibrillation, the clinical history was given. ECG finding was given. I don't exactly remember कि irregular narrow वाला. AFib का कुछ दिया हुआ था. And the question was, IV digoxin is required for ventricular rate control. Normal morphology heart, it cannot be seen. Then you have your the heart rate, pulse rate deficit is a good clinical distinct to diagnose atrial fibrillation. And the fourth one was cardioversion is required in all. Okay, cardioversion is required in all. What do you think will be the answer to this? See, what I believe here as well, cardioversion to sab mein lagega, but what they meant by this option was, it is your always the DC cardioversion, not the chemical cardioversion, the drugs wala. Right, you do have the drugs that you try for the rhythm control, right, flecainide वगैरह जो आता है. So remember, cardioversion is this not a good feature to identify heart rate, pulse rate deficit for AFib? So personally here, these are the two options that are confusing, right? So again, I'll put this in a controversy. Ki heart rate, pulse rate deficit is also one of the clinical features. Okay, so we'll come to the, yeah. Next one, ACLS पे question था, again something we have discussed in short. If you remember that flow chart of ACLS, any adult with tachycardia, you look at the QRS, narrow QRS, wide QRS, and the question definitely mentioned there was altered sensorium, and there were few other features. Was there hypotension? I don't remember that, but altered sensorium याद है, शायद hypotension भी था. So whenever it's an unstable patient, you have to first give cardioversion. Okay, so you have to give cardioversion. Hypotension tha shayad. So the answer will be cardioversion, not the vagal, the adenosine or amiodarone. It's going to be cardioversion. Next one, anticoagulant requiring monitoring is lepirudin. Okay, the answer there will be lepirudin and not enoxaparin, which you require monitoring only in renal failure patients, not otherwise. And other was dabigatran was the option. उसमें monitoring नहीं रखती है. So remember lepirudin. Voriconazole, again a question which is a controversial question. Empty stomach was true. Therapeutic drug monitoring is required. Remember, meals, fatty meals decrease the absorption of voriconazole. Therapeutic drug monitoring is required. One was loading dose, and the fourth option was cannot be given with pyrazinamide. Right, that was the fourth option. So both of these are actually correct. Okay, both of these are actually correct. So I don't know what the exact answer will be here. So again, I put this into controversial. Okay. Okay, Tech Minions, have you got this from Google anywhere? ठीक है? Okay, next one. This is also something which I definitely don't know the exact answer to. Did not get a list of all the drugs which are suicide inhibitors. I don't know from where they have picked this up. So which of these are suicide inhibitors? ये चार options say, right? I'm keeping it aside, not counting it. Next one, hyperprolactinemia वाला था, a mother who gave birth to a child, the child died, breast engorgement है, क्या drug दोगे? Basically cabergoline देंगे. Always remember the concept that dopamine is your prolactin inhibitor. Okay, so you will give cabergoline there. Dose of dexamethasone and betamethasone, remember dexa has X in it, so you give a dose of 6 for dexa. So it is 6 milligram for dexa. Total dose, remember we have discussed, is 24 milligram. So it has to give in 4 doses, 12 hours apart. Okay, this 12 hours apart. So dexa is 6, beta is 12. Okay, beta is 12, dexa is 6 milligram. ठीक है? हाँ अंकित, वो हमने डिस्कस कर लिया. Okay, next one. Contraindicated in PPH with hypertension is methyl ergometrin. Okay, the answer there will be methyl ergometrin. Next one, vertex position, जो outlet forceps वाला question था, ventouse use करोगे, outlet forceps use करोगे. Since the capo was present, we will not use the ventouse, it will increase the bleeding. Vertex 3+ है, suture already AP है, that means rotation नहीं है, so we will use the outlet forceps. Okay, we'll use the outlet forceps. Next question was on Mullerian agenesis. The FSH was given normal. Just one day before the exam, I told you that the normal values are 3.54 to 10. So FSH normal tha. Secondary sexual characters, breast was present. Remember the mnemonic for that? Auspicious AM. That is what we have discussed. Auspicious AM. That is absent uterus, secondary sexual characters present in A and M. Androgen insensitivity and Mullerian agenesis, MRKH. So auspicious AM, absent uterus, but the secondary sexual characters are present. Next one, imperforate hymen. Okay, so you guys are saying there was one option of low also. So again, this is something we will confirm कि इसका answer low होगा कि outlet होगा. ठीक है, so we will check that. Next, imperforate hymen was the answer because there was this blue mass, cyclical pain, the blue mass was seen, hematocolpus, imperforate hymen. Next one, severe pre-eclampsia patient, 36 weeks, impending eclampsia के features थे यहाँ पे, headache, blurring and vision, proteinuria 3+. So when there's impending eclampsia, you need to give magnesium sulfate. Blood pressure was high, so labetalol, and we will expedite the delivery, right? Impending eclampsia, best is delivery karo. So remember, this is what will be the answer. Labetalol, magnesium sulfate, and expedite the delivery. When do you give anti-D? Anti-D is given anytime when the Coombs test is negative. If the Coombs test is positive, the mother is already sensitized. There's no point of giving the anti-D there. So remember, the Coombs test has to be negative. This is RH incompatibility. It was given that mother is negative, so the baby will be positive. So O positive and DCT negative. That is what the answer will be there. RH incompatibility. So this is going to be the answer. Next, you have the question on ruptured ectopic, 6 weeks, fluid was present on ultrasound, cervical motion tenderness. Remember, cervical motion tenderness can be PID or ectopic. In this case, with fluid present, the ectopic has ruptured and it has led to fluid. It will not be abruptio. Abruptio does not come at 6 weeks, right? We talk about abruptio APH after 28 weeks. So this is ruptured ectopic, okay, ruptured ectopic. Next one, ARSA, the normal variant question of CT, aberrant right subclavian artery. In front of the vertebra, you could see the vessel. That was aberrant right subclavian artery, and there were other 3 branches of the arch of aorta, the 3 vessels that were seen. So the answer there is aberrant right subclavian artery. Next one was the image of chronic osteomyelitis, the irregular dense bone. Then chest x-ray showing the posterior rib end. Mount Fuji sign is seen in tension pneumocephalus. That was the answer there. CT value 0 is for water. That was the correct answer there. Then USG contrast is what can be used in CKD, not the iodinated or gadolinium. Next was the image of EDH. The pupil was dilated, unequal pupil, suggestive of the herniation happening. So that is why we have to do surgery as soon as possible, should be done. Hemothorax, the stab injury patient with the white out hemithorax, supine x-ray was given. The answer was hemothorax. Next was the patella fracture. Many of you are saying we could not see the patella fracture. But if you, basically this is what you should be doing in image-based questions. When you don't know the answer, try to rule out what can I see and what can I not see. When you have the option which is telling you patella fracture, tibial condyle fracture, try to look at that bones and see very carefully whether I'm missing on any fracture. So retrospectively, if you see the image, you could have seen the patella fracture. Okay, I've shown the image also yesterday. Okay, next one. No, that was not osteomalacia, that's chronic osteomyelitis. Pericardial effusion, the chest x-ray that was given with all the options, like pointing towards tamponade now. Remember, S1 loud was the false statement. You have muffled heart sounds. S1 loud was incorrect. Ensure technique. Whenever you have this new terms in INICET exam, no, try to decode the term. There is some hidden coding which is present there. So in ensure, remember this is intubation, surfactant and extubation. So SUR stands for surfactant. So we will use surfactant in respiratory distress syndrome. Okay, respiratory distress syndrome, right? Next one, short stature was given with upper segment, lower segment 0.8 to 1. That means the upper segment is small. Logically, वापस सोचो अगर नहीं भी पढ़ा है तो अगर upper segment short है, मतलब spine में vertebral column में there's some problem. So this is spino, the epiphyseal dysplasia. Next one, the question on chronic malnutrition, acute on chronic. Weight for age is not considered, right? According to WHO, do you remember the mnemonic, guys? We have discussed the mnemonic for this. What is the mnemonic? What is the mnemonic? Weight for height and height for age. Weight for height, height for age. You do not count the weight for age. So do not look at that Z score. Weight for height is minus 1.7, which is better than minus 2. To call it a decreased, a wasting, it should be less than minus 2. This is minus 1.7, so you will not call it as wasting. So this is not acute because wasting is acute. Height for age is decreased less than minus 2. So this is stunting which is present, and that is why this is going to be chronic malnutrition. Okay, this is not acute. You had only one option of chronic malnutrition. So that is going to be chronic malnutrition. Okay? So weight for age was given minus 3.2, but that is not considered. Weight for age, उसके लिए हम term use करते हैं underweight and overweight. It is not considered into wasting. So this will be the answer. ठीक है? नहीं, ensure was RDS, right? Acute तो है नहीं ना, क्योंकि wasting नहीं है. It is not less than minus 2. Some dehydration, 2 questions, both of them had increased thirst. What will not be present? Mental lethargy is not present here, right? Increased thirst is present, lethargy is not present. Delayed skin pinch is present, sunken eyes is present. What is not present? Lethargy is severe. Okay, lethargy is severe. Wasting nahi hai, theek hai, wasting nahi hai. Head circumference increases how much in the first 3 months? 2 centimeter per month. Okay, that is going to be 2 centimeter per month. Fetal IUGR, what is not the criteria for fetal IUGR? Fetal weight less than minus 3 standard deviation, uterine artery PI, umbilical artery absent diastolic flow, abdominal circumference less than 3 standard deviation. So the answer here will be, okay, the answer here will be uterine artery. For IUGR, basically uterine artery is not considered. It's the umbilical artery according to definition. Uterine artery is for PIH. Okay, the uterine artery high PI correlates with PIH per se. Not a conjugate vaccine or not a polysaccharide vaccine. Okay, that is what was the answer question, I believe. Polysaccharide vaccine कौन सा नहीं है? Hep भी नहीं है. Hep है, meningococcal है, and you have pneumococcal also. What is not a polysaccharide vaccine? Hepatitis B. Okay. Okay, Dr. Sheikh. पोस्टीरियर ही आंसर है उसका, वो एंटीरियर पे मार्क नहीं कर रहा था. Next one, which twin is not possible? Again, a concept that we have discussed in radiology also when we discussed the topic of the twins. I've told you that the amnion is like the room in which the fetus is staying. The chorion, the outer one, is the house, right? It is not possible that two people are staying in two different houses but the same room. When the room is same, the house has to be same. That is the concept there, right? So you cannot have a twin which is monoamniotic, that is the two people are staying in one room, but that is in two different houses. This is not possible. It is possible that the house is the same, it's monochorionic, but the rooms are two different rooms. But one room and two different houses is not possible. So monoamniotic dichorionic is not there. Okay? Next one, the image was given was of the gastrostomy kit. It was not the chest drain wala. Okay, it was PEG kit that was given. Next question was on pediatric free flow oxygen. What will you not use? Remember, we do not use the flow inflating bag wala option is the incorrect. We never use a flow inflating bag. We use self inflating bag. Tubing is used, right, or mask is used, but the flow inflating is not used. Okay, flow inflating is not used. Next one, a patient of rheumatic heart disease who is not compliant with the drugs and now has superior field defect. So definitely the option of CRAO, CRVO was out क्योंकि पूरा ही नहीं गया था, पूरा blindness नहीं है. And because they were particularly telling you कि RHD है, non-compliant है, that means फिर उसमें atrial fibrillation होके there is going to be embolism. I think that is what they were pointing to. So that embolism will affect the artery. So I believe that, I believe that the answer here should be BRAO. Okay, the inferior when it goes, the superior field defect will be there. So it will be BRAO is what I personally believe, right? Next one, chronic bipedal edema, which is the least common cause, whether it is venous insufficiency or lupus nephritis. Again, these two options were something which were confusing. The thought process was venous insufficiency is generally like, it's unilateral mein hum generally count karte hain when it's more like on one side. But then looking at the incidence also that we have ki lupus nephritis kitna common hai. So remember that, so this is going to be lupus nephritis may be more likely than the venous insufficiency. Definitely the option of flow inflating bag is out. Flow inflating bag kabhi use nahi karte hain. ठीक है? Next one, I'm telling you the thought process. I don't know what the examiner has thought. Okay, necrosis versus apoptosis cannot be differentiated by the shape change. Okay, the shape change tha, right? Shape change. Size change would have been is a differentiating finding, but not the shape change. Nuclear immunohistochemistry marker कौन सा है इनमें से? The answer here is INSM. Okay, INSM is a nuclear immunohistochemistry marker. Enterococcal infective endocarditis. ये मैं controversy में रख रही हूँ. Lupus nephritis mostly answer होगा. But if the examiner has thought like I did, कि venous is unilateral and not bilateral, nephritis is always going to be bilateral. So I don't know whether the answer he has thought of is venous insufficiency or lupus nephritis. I really don't know about that. Because looking at all the trappers, the tricks which are there in the questions, that's why I'm giving you that thought process. So you can keep it aside when you are calculating the questions that you have got right. Okay. Next one that you have here is enterococcal infective endocarditis was given. There's penicillin allergy. The answer will be vancomycin and not aztreonam. Remember, aztreonam is used in patients who are penicillin allergic, but for gram positive only. Gram negative only. It is not for gram positive. Okay. So remember, this is what is the answer. Vancomycin will be the answer. The thought process, how you could have marked this answer is, do you read about VRSA and VRE? Vancomycin resistant Staph aureus, vancomycin resistant enterococcus. So that would have given you the hint there कि भाई enterococcus के लिए we use vancomycin. Okay, vancomycin. Okay, so VRE answer है यहाँ पे vancomycin, aztreonam नहीं. Next was one this match the column question there. Syphilis, purulent suppurative infection, chickenpox, some cytopathic was given, berylliosis, granuloma, immunocompromised, no reaction. Guys, what do you think will be the answer here? What do you think will be the answer here? Yes? Aztreonam is not active against gram positive, याद रखना. आया था ये क्वेश्चन था. Right, so syphilis purulent separated, probably that's the answer here. I'm putting this into controversy again कि purulent nahi hoga, so syphilis probably the answer there. I'm putting this into controversy, I'm not sure of this answer. Next one, disposable pipette sterilization, or what will be used for that? Disposable pipette sterilization, this was multiple options, correct. So was there any option which gave ethanol and autoclave both, any option like that? So 70% ethanol and autoclave, if that is the answer there, I don't remember the options, then this is going to be the answer. Okay, so ethanol and autoclave are both are used for disposable pipette tip. Coming to, we are halfway through, so this is basically coming to the next answer. Even this is something I'm sorry I forgot to look into this. The Kaplan survival वाला जो graph दिया हुआ था, right, जहाँ पे you had control और उसके साथ ही NT-CD8 दिया हुआ था, right, then NT-CD4 was given, and both when NT-CD4 and NT-CD8 were given, right, the survival graph was given. Ceftriaxone में था ही नहीं, right. So this is basically is something I have to look into. I forgot to actually look into it, right. The concept here was कि जब सिर्फ CD8 दे रहे थे, anti-CD8 in the initial phase, it was not making a lot of difference to the survival. That is what was my thought process there basically. कि जब anti-CD8 दे रहे थे, so initial phase में the days of the graft were given on the x-axis, it was not changing any survival. But when you were giving it late, it was along with CD4, it was increasing the survival as compared to CD4 again. So probably this was the answer to CD4, CD8, both are important for survival. One option was both are responsible for rejection, one was both are responsible for survival. According to my logic, both are important for survival is important here. Still I will look into it and let you know. ठीक है, both वाला तो था, but both for rejection, both for survival, वो देखना है. Next one, the patient who has cough and thick sputum, what syrup will you give? So that is going to be bromhexin, which will liquefy the sputum. Whenever it's a cough with sputum, you do not give antitussives. You do not want the sputum to accumulate. So you will not give the antitussive codeine or dextromethorphan. These are antitussives. They are cough suppressant. तो ये नहीं देंगे. Bromhexin वाला आंसर होगा. Okay, bromhexin वाला आंसर होगा. ठीक है? Yes. So according to me as well, both are important for survival. That should be the answer here. Next, autopsy to see the live born fetus or dead born live born wala fetus ka sequence tha. So first is the abdomen, then is the thorax, and then is the brain. Okay, first is the abdomen to look at the diaphragmatic position. If the baby has respired, the diaphragm will go down. So pehle abdomen, fir thorax or fir brain, that will be the sequence. Blood products ka shelf life. Cryoprecipitate, match the column question. Again, you could have ruled out कि वो 1 year है, हमको पता है. We have discussed in bench revision recently as well. RBCs या whole blood वाला कुछ 42 days वाला था. Platelet is 5 days. So बचा हुआ granulocyte 24 hours वाला. That will be the answer there. Next one, delayed hemolysis transfusion reaction. What will you not see? Cola colored urine in 2 hours will not be seen. When you say delayed, it is after 24 hours. So within 2 hours is incorrect. Increased LDH will be seen. Increased indirect bilirubin will be seen. Unconjugated bilirubin. And you will not see no rise in hemoglobin after transfusion because of the hemolysis. So that will be the answer. Okay, that will be the answer. Next one. The sequence of action, again something we have discussed in biochemistry. If you remember HSL or LP L वाला जो diagram है, adenylate cyclase होगा पहले, फिर cyclic AMP आएगा और फिर protein kinase A आएगा. Right? We have discussed the phosphorylation happening for HSLP, that diagram if you remember from the magic book. So phosphorylation, HSLP becomes active there. So first is adenylate cyclase, which will form the cyclic AMP, and that will activate your protein kinase A. Inhaled nitric oxide is used to the treatment of pulmonary hypertension. Again, something we have discussed. GIS mutation not seen. The answer will be NRG. SGH wala mutation is seen. PDGFR wala mutation is seen. Right? NRG1 is something which is not seen. Annular lesion is not seen in The answer will be urticaria. You see the wheel here. It can be seen in pityriasis rosea, porokeratosis. The answer here is urticaria does not show annular lesion. It shows a wheel. Not done in primary survey, chest x-ray, CT head, endotracheal intubation, chest tube. So again, we have discussed in the bench revision surgery. In the primary survey, you have chest x-ray, you have pelvis x-ray, and you have spine x-ray. The CTs and the rest of them come in your secondary survey. So CT head is not done. Endotracheal intubation chest tube, your A, B, C, D, E. So in that, remember your endotracheal intubation chest drain is included. Hemothorax ke liye chest drain dalna hoga. So that is what is the answer going to be. Next one, tumor histopath image was given, whether it is adenocarcinoma, sarcoma, lymphoma, or a keratinizing squamous cell carcinoma. If you look at the image carefully, there was something like the gland wala beech mein se lumen tha, kuch tha. So remember that is adenocarcinoma. Okay, the answer there is adenocarcinoma. Next one, TB sputum sample is treated with, this is your assertion reason type of question. It is treated with N-acetyl L-cysteine and sodium hydroxide. The statement was true, the assertion was true, but the reason was false. Why? Because they had interchanged. Remember that NaLC, LC is for liquefaction of the sputum and sodium hydroxide is for decontamination. They had interchanged the options, so it was false. Okay, the assertion was true, but the reason was false. No, Santhan, no, urticaria will be the answer there. Next one, high quality CPR, which is not included, 3 to 4 centimeters nahi hota hai. In adults, it is 5 to 6 centimeters. So this was incorrect in high quality CPR. Ankylosing spondylitis, what is incorrect? Remember, ankylosing spondylitis is an inflammatory arthritis, and inflammatory arthritis ka hallmark is erosions. They cause erosions, right? That's why you have morning stiffness also, because it's an inflammatory arthritis. So the incorrect statement is it causes non-erosive. When we do the MRI, we do the CT scan, in the SI joint, we do see the erosions. When you look at the vertebra, we talk about the erosions coming in, the shiny corner sign, Romano's lesion, right? So remember, it causes basically the erosive one. Okay? Catalase positive infections are seen in chronic granulomatous disease. Tri-HP question, life-threatening injury, highest priority, that will go into the red category. There were 2 questions on fracture femur neck. In both of them, the patient was an elderly patient. Whenever the fracture femur neck, whether it is intracapsular, extracapsular, it's an elderly patient, all we have to do is arthroplasty, hemiarthroplasty, or a total hip replacement. When do you do the total one? Total is done if there is osteoarthritis also present, right? So in that case, you will do total replacement, otherwise hemiarthroplasty. So elderly patient with fracture neck femur, you have to go for hip replacement. Lineweaver-Burke plot, our favorite mnemonic, which will have definitely helped you here. Looking at the image, right? This is how the mnemonics help you to save a lot of time. Image dekha, directly answer yaad aa gaya, that if it is the crossing line, crossing C for C, crossing line is competitive. Non-competitive, if you have the graph which is V shape, right? Non-competitive, it is made up of V, ulta V and seedha V. Ulta V, seedha V, that is what forms the N. So this is non-competitive, and the crossing lines is the competitive, a time saver mnemonic. Okay, a time saver mnemonic. Next one. Kawasaki mein what is not seen? Again, a question where you could have logically guessed here. Ki Kawasaki is more like vasculitis, immunological mediated. It is not an infection per se. So it will not have purulent conjunctivitis. Purulent matlab pus producing bacterial infection वगैरह करेगा. Kawasaki is not infection. So that is why remember the answer here is purulent. Okay, purulent conjunctivitis. Down score, what is not included? So we have discussed this also. In your Silverman-Anderson score, respiratory rate is not included, right? What is the mnemonic for Silverman-Anderson score? Lung X, lower chest, upper chest, nasal flaring, grunting, and xiphisternum. Respiratory rate is not there. In Downs, it is included. Grunting, cyanosis, what is not included is feeding is not included. Okay, feeding is not included. Okay? Next one that you have, Grey Turnip, that's great. Kawasaki is cream, right? Next question was on DKA criteria, which is incorrect. Again, cheat codes could have helped you answer this question. If you remember a mnemonic again, alkalosis. Mnemonics were very, very like, saver mnemonics. So yes, Sasi, I will agree to that. Alkalosis is all K loss. Remember, alkalosis is all K loss. So generally you see hypokalemia with alkalosis, exception being RTA type 1 and 2, the acidosis where you see hypokalemia. While in rest of the acidosis, generally you would see hyperkalemia. So what is the incorrect criteria? That potassium will be less than so and so. That was the incorrect one. बाकी सब बराबर है उसमें. Anan gap बढ़ेगा. It's a high anan gap, ketoacidosis. Then you have the other one, bicarbonate will decrease, right? So that is what you need to know here. Potassium कम नहीं होगा. Which is a second generation LMA? What do you think will be the answer here? Second generation LMA कौन सा है? Yes, Proceal, right? Proceal is your second generation LMA. Okay, Proceal is the second generation LMA. Next one, risk factors for cholangiocarcinoma. Again, a controversial question. If you look into the risk factors for cholangiocarcinoma, okay, so remember that all of these actually are the risk factors. It is not just Clonorchis sinensis, even Opisthochus is a risk factor. So if you ask me which is the best answer out of this, the best answer will be hepatitis B. For the rest of them, remember the correlation has been shown to be a strong risk factor. This is a moderate risk factor. So the best answer here will be hepatitis B. Okay, Hep B. Next one, interventional radiology में कौन सा treatment करते हैं for aneurysm? Remember when we do the DSA. So when you are doing DSA, if you are seeing an aneurysm, what you can do here is you can coil the aneurysm. For aneurysm, either you do clipping or you do coiling. Clipping is something which is done from outside, so it's like open neurosurgery. Coiling is something which we do from inside. It's an interventional treatment. So remember, it's not stenting, it is not embolization. Here it is coiling. Next one, coffin lid. Coffin lid appearance was given there. Right, it was a coffin lid appearance. Remember coffin lid, we have discussed again. Coffin lid, funeral में जाते हैं तो white clothes पहनते हैं. It is true white. And remember true white, TR is the triple phosphate stone. True white का mnemonic याद है? It causes staghorn, triple phosphate, urease positive, white वाला coffin lid. Okay, so triple phosphate. You had a patient taking analgesics now has eosinophilia and WBC cast. Eosinophilia along with WBC cast, interstitial nephritis will be the better answer here. Okay, interstitial nephritis will be the better answer here. Next one, most common hernia in females. Again a trapper. Whenever we think females, FE, females, FE, we talk about femoral hernia. But femoral hernia is more common in females as compared to males. But overall, if they ask you what is the most common in the females, it is still going to be inguinal hernia. Which one? The indirect inguinal hernia. Indirect, remember in, it comes in the inguinal canal. So the one which comes from the inguinal canal, that is going to be more common, the indirect inguinal hernia. Okay? दोनों के लिए सेम ही रहेगा. वो 8.2 pH कहाँ से? हाँ, breast anatomy का question. Can someone help me with this? Breast anatomy. I'll provide the PDF. Don't worry. I'm trying to see the image. 10 lobes ही होते हैं क्या? कितने होते हैं उसमें? This is something that I forgot to check the answer for this exactly. I thought it was Spencer tail वाला, बाकी सब ऐसे गलत लग रहे थे. You know, looking at the options itself, it seemed like it did not seem very correct. Right? So Spencer tail is what I think is the answer, but still we will confirm that. Next one, a controversial question again. ठीक है. Parathyroid वाला था, all the features were of hyperparathyroidism, but they gave you calcium was less and parathyroid was more. So this fits into secondary hyperparathyroidism, which is basically renal osteodystrophy. So renal osteodystrophy, so I think that they mean to ask for the bones and a metabolic bone disorder. So renal osteodystrophy, you're gonna put it in the metabolic bone disorder. So probably bone wala was the answer here. But episodic headache के साथ जो बाकी सब features दिए थे and calcium was less, parathyroid was high, why will it give you the entire history of hyperparathyroidism? ठीक है. So renal failure causing the renal osteodystrophy, which is basically because of vitamin D getting less. So that will fit into metabolic bone disorder. So I think that was probably the thought process there. So bone wala jayega yahan, theek hai, bone wala. Next one, HER1 inhibitor. Here also there were multiple options, correct? So right, you can claim for this. Cetuximab एक था और दूसरा panitumab भी अगर option में था. Honestly, I don't remember the options. Just saw cetuximab, and HER1 actually is EGFR, right? So remember, it is EGFR inhibitor cetuximab, head and neck cancer. So this is something. If there was panitumumab also in the option, I do not remember the option honestly. ठीक है. I think multiple options इन्होंने कुछ गलत कर दिया था कि which is not a HER1 inhibitor देना था, and they've asked that which is a HER inhibitor. So probably another question which seems to be an incorrect question. Was trastuzumab, pertuzumab not in the option? Why do I think that those were also there in the options? Trastuzumab and pertuzumab. Okay. This was given in the question, right? The calcium is less, the parathyroid is more. This was mentioned in the question, the levels of calcium and parathyroid. Next one, for rocuronium immediate reversal, it is going to be Sugamma Dex. Sevoflurane is the inhalation agent of choice in children. Few questions were straightforward. Pediatric में IV fluid maintenance के लिए you give D5 and you give normal saline. Okay, D5 and normal saline is given. Do not give hypotonic saline in pediatric population, right? Do not give hypotonic. Next one, Oslo Declaration. Oslo Declaration is related to therapeutic abortion. Okay, it is related to abortion. Remember, for torture, TOTO, it is Tokyo Declaration. For torture, Oslo is abortion. Okay, Oslo is abortion. Right. Streptococcus agalacti, remember neonatal meningitis, we have discussed it so many times, Listeria, E. coli, Streptococcus agalacti. So neonatal meningitis, neonatal sepsis is what will be the answer there. It causes neonatal sepsis. Next one, what you have here is, tetanus mechanism of action. Think logically. Tetanus causes muscle contraction. That means it has more of excitatory, less of inhibitory. So what is it inhibiting? It inhibits the inhibitory neurotransmitter, that is glycine and GABA. That one will be the answer there. So tetanospasin, mechanism of action. D5 was definitely there, Kanika. Neurotransmitter not derived from amino acid, again a trapper here. So you would think that ki dopamine आता है tyrosine से, 5-hydroxytryptamine, serotonin is there. From tryptophan, GABA is glutamic acid, decarboxylation, vitamin B6. All of this we have discussed in short. We are going to do this, all of this again for your NEET PG exam. Trust me, for your NEET PG exam, the short is going to be a game changer and it will save a lot of your time. All the mnemonics will save a lot of your time. So make sure you are attending the live online short classes that we are going to do in the app. Creatine is also derived from amino acid. Remember the mnemonic MAG, create magnificent results. But remember, it is not a neurotransmitter. So that is why creatine is out. Creatine is not a neurotransmitter. वो GABA दिया हुआ था, ठीक है, GABA. Next one, Korsakoff psychosis, again the confusing options. Amnesia, confabulation to hai, but I don't think there was any option which was giving this, only 2 in the options, right? So again, this is something, I'll put this as a depending on what the options were. Amnesia, confabulation to hai, baki ophthalmoplegia और polyneuropathy देखना पड़ेगा, right? Next one, the skull injury image, the image that was given, that was the bullet injury. Diagnosis of high anion gap metabolic acidosis, where you were given all the values of sodium, potassium, chloride, bicarbonate. Definitely the anion gap was high. So whenever it's a high anion gap, it's of course there a metabolic acidosis. ठीक है? Probably all correct will be the answer there, है ना? हाँ, interactive होता है, exactly. Another question on acid base disorder, where you were given nausea, vomiting was given, pH was high, bicarbonate was high, PCO2 was somewhere 50, somewhere like that. It was metabolic alkalosis. So other question was metabolic alkalosis. Next one, indication of steroids. Indication of steroids in IgA vasculitis, that is HSP, Hinot-Schönlein purpura. If you look at the literature, it is abdominal pain. Okay, that is severe abdominal pain के लिए use करते हैं. This is abdominal pain for steroids. Okay, you can look at the literature. Cannabinoids are not indicated for, again तुक्का मारना, logical guess करना कि Rett syndrome का तो हमने drug अभी पढ़ा है, which is trofinetide, which is a new drug. That means nothing was effective for Rett now. So logically thinking tukka marna hai, so we'll mark the answer as Rett, and that is the correct answer there. Lennox-Gastaut, Dravet, tuberous sclerosis were the other options. Congenital adrenal hyperplasia, where they gave you a tall male with hypertension. So you know that the options were 21, 11, 3 beta hydroxy and some cleavage enzyme deficiency. So जब हमने कहा कि hypertension, do you remember our mnemonic? 1 at 10th place will be hypertension. So 1 at 10th place was only in 11. You do not have the option of 17. So automatically the answer here is 11 wala. Remember 1 and 1. 1 at 1 place is virilization, 1 at 10 place is hypertension. So virilization, more androgens, the male will have precocious puberty, and that is why a tall male. Okay, that is why a tall male, because of virilization, you are seeing precocious in the male patient. ठीक है, is this clear with everyone? हाँ. Next one, a teriparatide intermittent side effect is osteosarcoma. Okay, the other options were net bone loss, osteonecrosis. The answer is osteosarcoma. Renal tubular acidosis, which option was incorrect? The type 4 has hypokalemia. Remember the mnemonic, 4 has more. Which is the renal tubular acidosis, important for your all NEET PG and FMGE exam also. Which has more? It is 4. More potassium, it is your type 4. That was the incorrect statement. False statement was that. ठीक है? Next one, नहीं, check करना abdominal pain है उसका answer. I also thought it is GI bleed, but it is abdominal pain. Okay, that's abdominal pain. Another question was diuretic site of action. Spironolactone collecting duct, osmotic distal was incorrect, carbonic anhydrase proximal is correct. So both these two were correct. Thiazides are on distal, not on proximal. That was incorrect. Okay? So remember, this is spironolactone and carbonic anhydrase was correct. Next one, diabetes mellitus with renal progression. Some question on ki which drug will not stop or help in the renal disease. The answer there will be hydrochlorothiazide. हाइड्रोक्लोरथाइजाइड. एक था कोई फ्लोजन वाला ड्रग आ गया था वापस यहाँ, शायद ARB वाला कोई ऑप्शन था, फिनेरिनोन, राइट, ऐसा कोई ऑप्शन था. सो रिमेंबर द आंसर देयर इज थाइजाइड. ठीक है, थाइजाइड. साइनाइड पॉइजनिंग ट्रीटमेंट, व्हाट डू यू यूज? अमाइल नाइट्राइट प्लस सोडियम नाइट्राइट प्लस सोडियम थायोसल्फेट. Okay, amyl nitrite, sodium thiosulfate, Lilly's kit. Remember, that is your cyanide poisoning. The drug of choice now we have is hydroxycobalamine, but remember, this is all what you have will be used in cyanide poisoning. Okay, cyanide poisoning. ठीक है? Next one. Then you have a hemoglobin calorimetric का instrument that was given, IBQ. तो वो calorimetric वाले 2 ट्यूब्स तो लगेंगे, प्लस क्या लगेगा? प्लस लगेगा RBC पिपेट, which has that red bead. Okay, which has that red bead. So that's what you need in your calorimetric estimation. Next one, ABO antigen antibodies, all were correct कि carbohydrate है, IgM type होता है. The other options were whether it is carbohydrate, and if there is no antigen, then the antibody will be present. The incorrect statement here will be present since birth. Remember, it takes like 3 months, 5 months around basically for the antibodies to be reaching to their maximum. So the best answer option there will be present since birth. Okay, present since birth. Blood donation in emergency, we do not have the the blood group known. What do you give in emergency? O negative and O positive. AB negative is going to be the best plasma. अगर plasma देना है तो AB negative. Plasma should not have the antibodies. ठीक है? So AB negative. So this is what is going to be. No, it is O negative, O positive. Proximal third femur shaft fracture in a 26-year-old male. What will be the treatment? The answer there will be nailing. Hip spike how you do in a child, right? So remember the answer here is your nail, जो भी nail वाला option था. STI which is drug resistant becoming drug resistant, remember gonorrhea. We talk about Neisseria, meningitis maybe, yeah, overall the drug resistance developing. So remember you have PPNG, the penicillinase producing Neisseria gonorrhea. So it is getting resistant, gonorrhea is the answer here. फिजियोलॉजी क्वेश्चन, जब हाइपरटेंशन होता है तो ऐसे नोड क्या सीक्रेट करेगा? सो रिमेंबर हाइपरटेंशन, व्हाट इज द रिस्पांस टू हाइपरटेंशन इन आवर बॉडी? बैरो रिसेप्टर में क्या होता है? व्हेन देयर इज हाइपरटेंशन देयर इज टैकीकार्डिया, व्हेन देयर इज हाइपरटेंशन इट इज ब्रैडीकार्डिया, राइट? सो टू कॉज द ब्रैडीकार्डिया व्हाट शुड बी कमिंग हियर? इट शुड बी एसिटाइलकोलिन. If you look at the options, the other of them were sympathomimetic. Only one which was parasympathetic was acetylcholine. Okay, acetylcholine. So the answer will be acetylcholine here. Okay. Next one, Beck's cognitive levels. I do not remember the options here, but these are the correct ones. कि Beck's cognitive में dysfunctional assumptions included है, negative automatic thoughts हैं, core beliefs है. Does anyone remember the option here? The fourth option which is not included, which is not included in the Beck's cognitive levels? Introjection. Was it okay? Introjection here. All right, so that will become your answer here क्योंकि बाकी तीनों तो I think ऐसे ही वाले थे options. Okay, so remember that's what is going to happen there. Next one was supportive psychotherapy. Supportive psychotherapy is not given in, remember it is not given in motivated individuals, rather you give it in demotivated individuals. ठीक है, it is given in demotivated individuals. So the answer there for supportive psychotherapy is it is not given in motivated, it is given in demotivated is who will require the supportive psychotherapy. ठीक है, next one. Hemophilia, was it hemophilia A or hemophilia B? If it was hemophilia B, so you will cryoprecipitate factor 8 is what you give for hemophilia A. Cryopoor and FFP is what you will give for hemophilia B. Okay, FFP and cryopoor. Next one, OCD mental health gap में आएगा. Okay, mental health gap, this is what it is. What is not included in the mental health gap, the action project that we have? OCD is not included. Schizophrenia है, childhood disorders है. The other options were schizophrenia, childhood mental disorders. OCD was the answer here. Next one, Salter-Harris fracture passes through which zone of the cartilage? Remember that is the hypertrophic. Okay, that is hypertrophic. Next was the image, basically the image of the bone, the histology image, and where they asked you where does the calcification take place. You know, something like this, the bone was shown here and this is what was shown. So just above that, above this bone area, the area that you see here, this is the zone of endochondral ossification. Okay, this is the zone of endochondral ossification just adjacent to this ये वाले जो areas थे उसके बाजू में. So the zone of endochondral ossification is what will be there. ठीक है, हाँ, इसीलिए तो इन्होंने इंक्लूड नहीं किया मेंटल हेल्थ गैप में, क्योंकि ओसीडी किसको नहीं है, ऑल ऑफ अस हैव ओसीडी, राइट? सो किस किस पे एक्ट करेंगे वो? सो लॉजिकली थिंकिंग, इफ यू हैड टू गेस द आंसर, दैट इज हाउ यू वुड थिंक कि ओसीडी इज लाइक सच अ बिनाइन थिंग कि they will not include in the mental health gap. So that's how you could choose the answer of OCD. तुक्का मारना ही है तो logically सोच के मारना चाहिए, right? It should not be that अक्कड़ बक्कड़ वाला तुक्का. Next one, OSA का question जो था, OSA, which is the incorrect statement in OSA, that is going to be pharyngeal muscles, increase in the pharyngeal muscle tone causes apnea. It's the other way round. Remember, it is a pharyngeal muscle relaxation. If this is the pharynx and the muscles are relaxing, they are not contracting, they are not tight muscles. So when the pharyngeal muscles relax, that is what basically leads to apnea. So it is the not the tone increased, it is the tone decreased. Okay, tone decreased. ठीक है वो I think there's some query, I might be wrong here because I'm not pretty sure on that. Sally's hemoglobin calorimetric वाला कहाँ गया? उसको भी मैं स्टार मार्क कर देती हूँ so that you guys don't count it there. See, I might be wrong there. Okay, so this is what I'm marking. We need to check on this. ठीक है? All right. कहाँ पहुंचे हम? यहाँ पहुंचे. Next question was upper motor neuron lesion. What do you not see? You definitely know that there's no fasciculations, there's no muscle atrophy. So there's going to be increased deep tendon reflexes and rigidity. What causes pigmentation? I hope you remembered me when you had this question. Short में discuss किया. Clofazimine colors the skin. Similarly, we have remembered chloramphenicol colors the skin of the baby, gray baby syndrome. So clofazimine, chloramphenicol colors. So remember, it is clofazimine. Okay, it is clofazimine. Okay, next one. Gram-negative intracellular diplococci, that was in that lengthy question, guys. Remember, all the lengthy questions had the crux in the last two lines. Even in this question, that word there, the entire history, distracting story was given. But the last line gave you that clue that gram-negative intracellular diplococci एक ही हो सकता है, which is Neisseria. Okay, which is Neisseria. ठीक है? Rapid cycling not there. Again, a logical तुक्का here. Remember rapid cycling, जो भी emotional outburst ये सब होते हैं, you know, these are more common in females. If you remember from a personality disorder classification also, cluster B, Benjis are the ones which are emotional wild. So remember the incorrect statement there. That's why I said कि ये questions बड़े ही अजीब questions थे. What is not true? It is more common in males. More than 4 per year associated with hypothyroidism. And what was the other option there? What was the other option there? So more common in males is incorrect. Remember, it is females more than males. Okay, that is the answer here. Next one, most common cause of proptosis in middle age, that is going to be the thyroid eye disease. Superior oblique actions, again a very, very favorite. We have discussed this so many times. SYNRAD. Superior cause intorsion, recti cause adduction, so obliques cause abduction. So what does it not cause? It does not cause adduction. Third nerve palsy, what do you not see? Limitation of abduction, because abduction is LR6, lateral rectus. LR6, SO4 is paired, right? And that is why, remember, you will not see the limitation of abduction, something which we have discussed again. Okay? Hypothyroid is known to be a cause of depression and mood disorders, adding to that. Next question, right? So we are at question number 170, right? The last 30 questions here. Next one that we have here is spinal nucleus of the trigeminal nerve carries what sensation? It is the pain sensation. Proprioception carrying nucleus is the mesencephalic nucleus. Spinal, remember spinal is the general sensation carrying the pain wala. Okay, that is pain. Next one, okay, the other option here, rapid cycler mein, I'll add the option of antidepressant wala, trigger antidepressant. ठीक है. All right, so we have got the question which is repeated, right? This is the question which is repeated here, and that's why probably I got a total of 201 questions. ये हमने already discuss किया है, single stranded, double stranded वाला. Headache, severe headache, what is not a criteria? I actually do not remember the options here. So, more than 50 years was correct option, that is correct. What is the other options that were given? I don't remember the options to this, and so the answer to this. Anybody here remembers their options for headache, severe headache wala? Ek more than 50 years is what I remember. What was the other option? Yes. Anyone? Let me know if you remember, then I'll come back to this. Febrile seizure, not true, right? Again, when I'm diving into the options and trying to look into the literature, very good. एक option था यहाँ temporal artery वाला tenderness, so pointing toward giant cell arteritis, which is a severe headache. Okay, subacute worsening, progressive subacute worsening, और दूसरा क्या था? Cocaine abuse. तो इसका हमको देखना पड़ेगा आंसर क्या है, putting this into controversial. Okay, right. Febrile seizure, not true. When I'm looking into the, diving into the options and trying to look into the literature, so the, what comes out to be the right answer will be surprising one. Nahi, Pradyum, actually 54% hai. If you look at the literature, it is somewhere between 30% to 70%. 54% has specifically been mentioned in one of the articles, which tells that out of the children who have a febrile seizure, 54% are the ones who will experience only one more episode after the initial episode. So 54% wahan aata hai. Everywhere you read, the age given is 6 months to 5 years, while in the question they mentioned 6 months to 6 years, and I believe that was the answer there. Okay? So right, so it is not 6 months to 6 years of age group, it is 6 months to 5 years of age group. 54%, like I said, has been mentioned in one of the articles. Okay, next one. Next one, which is myelodysplastic syndrome, false. Again, if you look at here, it is there in elderly. The therapy related MDS, that is not going to be age related, because it is related to the period of exposure. Agar someone is receiving chemotherapy, radiotherapy early, they will get the MDS early. So that is not age related, otherwise it is age related. The incorrect statement here is females more than males. It is actually males more than females. Myelodysplastic is more common in males. Okay, that is what it is. Yeah. First one, next was EEG, EOG and EMG, where the EMG was a flat line telling you that the muscle tone पूरा ही चले गया है. EEG में से sawtooth wave appearance है, that is going to be the REM. Okay, that is going to be REM. Vishrut, is it that the 6 years is a new update? तो मैं इसको यहाँ पे डाल देती हूँ क्योंकि मैंने जितना चेक किया उसमें 5 years ही लिखा हुआ है. ठीक है? All right, next one. Fetal growth is not done by, this is a repeat previous year question. Answer here is growth hormone. Other options were IGF, thyroxine and insulin. Anaphylaxis criteria. So if I show you this criteria, so I've got this image here. Persistent gastrointestinal symptoms is one of the criteria here. Okay, bronchospasm, respiratory compromise is going to be there. What else was there in anaphylaxis? Remember, there's going to be hypotension, not hypertension. Okay, so one point where I see that this was not being discussed, right? We were under the ignorance. Remember, persistent GI is included, hypertension is not included, bronchospasm is going to be there. Was there urticaria given? Urticaria? EMG में spike था, EMG flat था. Okay, so if you think that in this guys 54% में afebrile लिखा था कि non-febrile seizure होगा, so then that will be the answer. Okay, next one was next question. इसमें मेरे को options याद नहीं आ रहे. Urticaria, hypoxia. So this will be there, this will be there, this will be there in basically your anaphylaxis. Next one, quadruple test telling you that कि Downs का risk कम है लेकिन neural tube defect का risk ज़्यादा है. अगर वो Downs होता, then we would have gone for amniocentesis, genetic testing, all of that, because it is neural tube defect. Remember, neural tube defect has multifactorial inheritance. It is not like anything you would find in the karyotyping or anything. Neural tube defect है तो next करना पड़ेगा anomaly scan. So you should carefully evaluate for the neural tube defect, the spina bifida, that should be easily seen. I am reading the YouTube chat, Bhavika, right? I'm seeing the options there. Lip swollen was given. Okay, so that will also be included. Mucosa involvement दिया हुआ है यहाँ. right? Involvement of the skin and the mucosal, that is the swollen lips. So skin mucosa is given. ठीक है guys. So if the age ये वाला has been updated, then you go for this 54 years, 54% वाला. ठीक है. Next, disease transmitted by all the components. Syphilis will be a better answer than malaria here. ECG, posterior wall MI, where you had V1, V2 May, ST depression was there, posterior wall MI. Next was right, vitiligo, which is stable and not progressive, that is segmental. Right, the segmental will be the answer there, segmental vitiligo. Then the patch test, KOH mount split skin smear, patch test contact dermatitis, this is for tinea, this is for leprosy, and you had biopsy for lupus vulgaris. Okay, biopsy for lupus vulgaris. Next one, most common hernia in female, ये भी repeat हो गया है. Right, we have already seen it is indirect, so एक question missing होगा फिर. Next question was on hepatic encephalopathy, where they gave you the patient with portal vein was minimally dilated and there was some altered sensorium wala, so they were pointing towards hepatic encephalopathy. So hepatic encephalopathy mein lactulose denge, right, that is what will be the answer here. Amyloid was present, the answer is going to be medullary thyroid cancer, which comes from parafollicular C cells, okay, not the Hürthl cells, follicular, parafollicular C cells. CT is the connective tissue. What is the cause of aneurysm? By causing connective tissue degradation. Degradation is caused by atherosclerosis. Atherosclerosis by affecting the intima, the connective tissue, that is how it makes the wall weak and leads to aneurysm. Which is not a post-transcriptional modification, glycosylation is not there. What are the post-transcriptional modifications that were given? Capping was there, methylation was there, endonuclease cleavage was there. Okay, endonuclease cleavage was there. ठीक है, हर्निया भी रिपीट हो गया, करेक्ट, दो क्वेश्चंस रिपीट हो गए. Very weird question, suppressor change जो होता है, what is the mutation which will change the suppressor mutation to the phenotypic variant, like basically the wild variant. Normal कर देगा, it will suppress that mutation, the suppressor mutation. The answer to that will be tRNA mutation. So suppressor mutation is basically where you get a stop codon that comes in the mutation, and so the protein gets abnormally short, you get truncated protein, which is dangerous, right? So we do not want that. So what do we do where there is stop codon which is inserted? We do the tRNA, the tRNA mutation. What happens is you change the anticodon which binds to the codon. So instead of the stop codon, it is converted into the missense mutation. Okay, instead of that you get a missense. The amino acid is changed. Rather than stopping the protein synthesis, you convert the amino acid from one amino acid to another amino acid by the tRNA mutation. Okay, that was the answer there. Which is not a growth promoting oncogene, TGF beta. Remember F beta, we have discussed so many mnemonics out of this. Causes fibrosis, which is a good effect. It's anti-inflammatory. It is your inflammation suppress karne wala. So TGF beta is not a growth promoting. Fish is not for point mutation. Metabolites levels detect karne hain, which will help in a genetic disorder. The answer there will be tandem mass spectrometry. Nutritional rickets, which is the false statement, increased urine calcium. Already in rickets, right, because of the nutrition, vitamin D less, calcium is less. So the body will conserve the calcium rather than throwing the calcium in the urine. So logically thinking, increased urine calcium, creatine will not be seen. Normal calcium can be seen, which is maintained by the parathyroid activation, right? So the answer there will be increased urine calcium. Okay, increased urine calcium. Who's getting 151? पोस्ट ट्रांसक्रिप्शनल था, पोस्ट ट्रांसलेशनल नहीं था, पोस्ट ट्रांसक्रिप्शनल था. Yes, those were the reciprocal changes, Kora Roja, right? It was a depression. Instead, when there's posterior wall MI, you will see the depression in the anterior leads. हाँ अमरेश, नहीं तो ऐसे ही थोड़ी बताऊंगी ये सब. Arnav, that is superb, right? Arnav, do let us know. right post results as well. Coming to the last 7-8 questions, guys. Drug which decreases serum parathyroid levels. Risidronate, bisphosphonates increase the parathyroid. The answer here is going to be calcitriol. Okay, calcitriol decreases the parathyroid. Next one, eonism. Remember the mnemonic? Eon brand ki vest. So transvestism. Fraught, rot is rub, rubbing of the genitals. Algo, anywhere. Algesia is pain. Necro is dead. Okay, necro is dead. Next one, adolescent male with epistaxis. That's going to be juvenile. Adolescent is juvenile nasopharyngeal angiofibroma. Does anybody remember the options here? Hypokalemia does not cause. Hypokalemia does not cause which of these? Yes. One option was diabetes insipidus. Was the other option VTAC? And what were the other two options? I really do not remember this. Cerebral edema. Okay, one was cerebral edema. What was the other option? What was the other option? Just paralysis. Okay, just paralysis. So, if we try to rule out the options, hypokalemia, hypercalcemia are known to cause this nephrogenic wala diabetes insipidus. Okay, hypokalemia, hypercalcemia. It can cause all the arrhythmias including VTAC, and you have this hypokalemic periodic paralysis also. It can cause paralysis. So, if we go by the options, it should be cerebral edema. Quadriplegia था तो मुझे नहीं पता आंसर फिर यहाँ पे quadriplegia direct हो सकता है या cerebral edema. So I'll put this cerebral edema might be the answer here क्योंकि cerebral edema is more so related to sodium के levels changes, right? You can check the literature. It's calcitriol. Okay. Next one. Spastic quadriplegia in a child. What will be the most common finding in MRI? It's going to be PVL. Rule out the option. Cerebellar degeneration. जब cerebellum जाता है, imbalance is there, and there is hypotonia, not spastic. So this is out. Basal ganglia will cause abnormal movements. So the best answer here is going to be PVL. Anybody remembers the fourth option here in spastic quadriplegia? Anybody remembers the fourth option here? One was periventricular leukomalacia, one was cerebellar degeneration, what was basal ganglia calcification, and what was there? If you remember, do let me know. Oh yes, great. That was cystic encephalomalacia. Okay, that was cystic encephalomalacia. So remember, when they're telling you spasticity, that means the upper motor neuron, the white fibers are getting affected there, upper motor neuron in the brain. So leukomalacia, periventricular leukomalacia, where your white matter tracts are coming from the cortex, that will be spastic. Okay, spastic. Okay. Next one, rodenticide wala poison wala history tha. There was hypokalemia which was given in the question ki potassium kam hai. Remember hypokalemia wala, the answer is going to be barium carbonate. Barium rodenticides, they are known to cause hypokalemia. Next one, heme breakdown will not give what product? The answer will be ALA. Aminolevulinic acid will not be there. Carbon monoxide is there. Ferric is there. Biliverdin is there. The answer will be ALA. Heme breakdown में ALA नहीं आएगा, CO आता है, carbon monoxide आता है. Next one, allergic rhinitis. What do you not see? You see the Denny Morgan fold. You do not see this Otto fold. Otto fold is seen in depression. What is seen? Allergic shiner, allergic solute is seen. Denny Morgan fold is seen. Right? Denny Morgan is seen. Allergic shiner, allergic solute is seen. But what is not seen? This Otto fold is not seen. Okay? Otto fold is not seen. ठीक है? 171 question में क्या है? Virus wala we have discussed already, you can check that. Suppressor वाला बताया उसका आंसर, tRNA mutation. And another question was on Wilms tumor. What is incorrect for Wilms? Again, I do not remember the options. Few options I remember कि first 5 years में आता है. Then was कि pulmonary metastasis is rare and comes late. What is the other two options? Do you guys remember the other two? The most common presentation is abdominal mass. What was the fourth option? What was the fourth option there? Rohit, for FMG, do not do INICET papers. First do the NEET PG, FMG and NEET PG. Chemotherapy, radiotherapy वाला था. Chemotherapy, radiotherapy. ठीक है? So we, I think the better answer here will be to go with this because you have to do radical nephrectomy. Just the chemo radio does not help. It is radical nephrectomy that's need to be done. Some of you are giving me the reference for Ghai for this spastic quadriplegia, putting this into controversy, and we will check that whether it is PVL or it is cystic encephalomalacia. Okay, PVL है कि cystic encephalomalacia, we will check that. ठीक है? Right. So this completes your complete recall, guys, and 80% respond to chemotherapy vagera. More than chemotherapy, surgery has to come here. So this again is something that we have to get the exact recall. Radiotherapy nahi tha. Okay, radio nahi tha, to theek hai. Wilms is actually a radio-sensitive tumor. Okay, radio-sensitive tumor, right? So this was the entire recall, guys, based on whatever we have discussed. Like I told you, ki do not worry if you do not score good in the INICET exam. The paper was a bit weird and eccentric, but NEET PG definitely is a more like very discrete and definite questions is what you get. There are no ambiguous questions in NEET PG, and they do test you on the standard topics and the standard questions that you get. So all the students who are appearing for NEET PG or even for upcoming FMG exam, so guys, what you need to do is please make the best of this opportunity just to make sure that everybody gets a chance to learn all the mnemonics and tricks which are very, very time saving in the exam. Trust me, I can tell you from my own personal experience, yesterday's experience. They are very, very time saving. Please make the best of this opportunity. I will be giving you the entire plan, the timetable tomorrow, right, in the YouTube live session that we are going to have tomorrow. Tomorrow is 21st. All right. So we are going to have the YouTube live session tomorrow at 6:30 p.m. I'll give you an update on that. Right. And the entire plan, how will we do it, what will we do it, and what all we'll be doing there, everything I'll tell you there. So just stay tuned for that. Still that, use this recall as your learning session. Basically, if you get any question from here in your NEET PG exam, you should not make a mistake in that. So that was the whole purpose of giving you this authentic recall, so that you know that what topics have been asked in the INICET exam, and this gives you a quick review of all the 200 questions. Yes, Dheeraj, that's why. So Arnab is definitely going to get back. The paper is a standard paper, I believe. INICET जैसे हमेशा होता है वैसा ही है. So whatever has been, you can check the previous results and check that कि what score gives you what rank. Correct of 145 to 150 should be there to get a great rank is what I believe. 150 उसके around या उससे ज़्यादा होना चाहिए to get a good rank. Timings for short, it will mostly be in the early morning. Okay. See, the cutoffs and all are very much decided by how everybody attempted. So that's a very, very dynamic thing. And the best part about INICET is give you the results in like just 1 week itself. So that's the best part. So do not overthink and use this recall just for learning. रोहित, एग्जाम तक हम सेशंस करते रहेंगे, राइट? Yeah, so I think 120, 130 correct, whoever is getting 120, 130, 135 correct. might not give you a good clinical seat in the central institutes, right? The rank thoda sa it will go पीछे शायद like 120 to 130. More than 130 might give you some decent rank depending on how everybody has performed. But yeah, 140 plus, 150 plus is definitely what should give you a good rank. 140 plus and 150. ठीक है, so do let me know guys once you get the results what you were expecting and how much rank did you get, so that we get an idea on that also. And remember, no exam results define your worth and define you as a person. No matter in whatever attempt you are cracking your PG entrance exams, after how many years of your graduation you are doing it, it really does not matter at the end. Down the line when you will grow and when you will be in your 30s and 40s, then you will realize कि जितना tension हम ये सब चीजों का लेते थे, it's actually not all that worth it. So do prepare for these exams well, but at the same time, your mental health is very, very important. Spending time with your family, with your friends is also equally important. So compartmentalize your day and do everything that is the need of the hour. And take care of your physical health, emotional health, mental health, spiritual quotient, everything, right? So that's very, very important. So that was about it, guys. Thank you so much. I'll share this PDF with the annotated one, the answers that we have discussed, on my Telegram group. Okay. So thank you. Goodbye. Take care. See you tomorrow for the plan, for the next 1 month plan for the NEET PG. Everybody should make the best of it. Trust me when I tell you that, not just because I am going to take it, but as your well-wisher, I'm telling you, no matter whatever resources you have used in the past, still this is going to help you retain all of that information. So don't think of it as a new resource, use it as a booster resource that is going to boost and help you retain and remember and reflexly recall everything in the exam hall. So stay tuned. I'll see you tomorrow there. Goodbye. Take care and keep studying. Keep revising, keep synapsing, and keep winning. Thank you so much, everyone.